high cost of health insurance coupled with a decrease in income levels has led to approximately 42,000 people opting out of private health insurance. Yet at the same time, the HSF, that's the Hospital Saturday Fund health plan, has seen a 25% growth in their customer base, indicating that healthcare cover at some level is still a priority for many people. So if you have private health insurance, can you switch to something else and save money? Just what is a health cash plan? And if you leave insurance altogether, do you know what waiting period you'll face if you want to be insured again? Well, Tina Leonard has the answers to all of those. But first of all, the HSF, the Hospital Saturday Fund.
It's a great name, isn't it?
What is it?
Well, the Hospital Saturday Fund originally, it goes back to 1873 actually in the UK. The Hospital Saturday Fund was a charity founded by one-time senator in the Irish Parliament, a man called Reginald Brabazon, the Earl of Meath. And at that stage it was people were paid on the Saturday, and it was a fund they could pay in towards their local hospital. But since 1949, the HSF health plan, that is the trading company of that charity, and has been operating in Ireland since 1949. And basically it's a health cash plan. So it differs to your private health insurance, because your private health insurance really focuses on inpatient care, hospital cover, your private or semi-private room, whereas the health cash plan and the HSF health plan focuses on outpatient stuff. So I'm talking about the cost of your doctor, your dentist, your optician, your chiropodist, your all of those sorts of things, day-to-day health care that you might need.
It's not for profit.
It's not for profit. The charity isn't for profit. HSF health plan is a trading company, so they do make a profit. But because they're the trading arm of a charitable organisation, the money goes back in, and money is distributed to other charities and put back into the business. And of course, the reason why a lot of people haven't heard about them is because they don't use the money that they earn to do huge, big, expensive advertising. So a lot of their business is word of mouth.
How much does it cost?
Yeah, plans cost between €2 a week and €17 a week. Now, that would be for a family, because children are always free. And how it works is this: you pay as you go for your doctor or your consultant or your pharmaceuticals, your eye test, whatever it is, the dentist. And then you keep your receipt and you submit it immediately, or at least within 6 months. And you can claim back then either a cash amount, or it's going to be between 50 or 100% of what you've paid, depending on the type of plan you're on. There's no excess whatsoever on any plan. So it isn't a situation, with your private healthcare, you might have some consultants' visits or doctor's visits. Maybe you've had 2, but the excess is 100 and something euro, so you can't claim anything back at all. Whereas with this cash plan from a HSF health plan, there's no excess. So if you have a few doctor's visits and a few dentist visits, then you just get the cash back, and
now,
you don't.
On the face of it, you're thinking, €17 a week, that's good value. Multiply it by 52, and it's 884 euros. But that's for a family.
That's for a family.
It doesn't cover your inpatient, so therefore you're going to have to go public.
Well, yes, you are. And interestingly, what a lot of people are doing is combining a lower level of private health insurance with the HSF health plan. So they're thinking, well, and especially younger families with younger children, because they're thinking, look, if you're in a situation where you think you're not going to, the likelihood is that you're not going to get really sick and need to go to hospital, but you need that day-to-day GP, dentist, you've got children who get sick all the time, then the health plan might be more suitable for you, because it covers those day-to-day expenses, and then you might lower your private health insurance. So that's what a lot of people are doing. Some people, of course, as you said in the intro, 42,000 people have left their private health cover. But what's interesting is that the HSF health plan now have 100,000 customers, and that's grown by 25%. Right. So a lot of people are switching.
For your children, if they have to go into hospital, they're effectively going to be in a public bed, because there's no all mod cons at the moment in the children's hospital, and in the projected children's hospital, all the rooms are going to be the same. They're all going to be en suite anyway, so public or private, it won't matter. Look, we'll come back to this after the break.
Okie doke.
Now, Tina Leonard is still with us. We were talking about the Saturday Hospital Fund and the kind of plans they have, which will reimburse between 50 and 100% of your medical expenses for an expenditure of perhaps up to €800 a year, but then you have to go public, as it were, or have a diminished level of cover from VHI, Quinn or Aviva.
Yeah, I suppose the important thing is if anyone's switching, especially if you're just going with the HSF health plan, is that you're not going to be covered for private inpatient care in the hospital. That is important to know. But you will get cash back. In some instances, it's a percentage rate that you mentioned. Others, it's a flat rate. For example, you get a birth grant of up to €171. It's a flat rate. Or even for public hospital stays, they do give money back per night, between 75 and €120. So there's flat rates for certain things. Lots of different plans there, but you can go to their website and check
the
that
HSF
out.
have a website.
They do, and now I can't remember what it is.
The HSF, Hospital Saturday Fund, you can Google that and you'll find it easy
it'll
enough.
be there.
Now, if you do quit your health cover, your VHI, your Aviva or your Quinn, what is the difficulty in getting back to full cover?
Yeah, and this is really important for everybody to know because so many people are leaving. You need to know that if you leave a gap of more than 13 weeks, then basically you're starting all over again and the waiting period applies. So the waiting periods are going to depend on your age. So if you are under 55, the maximum waiting period is 26 weeks. If you are aged 55 and under 65, it's 52 weeks. And if you're over 65 years old, the waiting period is 104 weeks. That's an awful long time.
So
okay?
That's 2 years.
Absolutely, it's a huge length of time. Now, within those waiting periods, you are going to be covered if, God forbid, there's an accident or an injury while you're waiting for full cover. But be aware that if you stop your cover, if you leave your private health policy now, or indeed, I mean, the same rules apply to the HSF cash health plan as well, and you leave that gap of 13 weeks, then you're going to be waiting. You'll sign up again, you'll pay your money, but you won't be fully covered until those waiting periods have passed. That's really, really important to know.
All right, and I can give you the HSF website. It's hsf.eu.com.